taken far too early. I stand with those who demand justice for Breonna. We must demand justice for every precious black life cut short by systemic racism all across our country. My thoughts and prayers are with Breonna's family, the people of Kentucky, and every person across our country, and obviously right here in the city of Boston who is experiencing pain right now. There has to be more transparency when incidents like this occur. Justice is demanded. I also want to recognize we're still mourning the loss of Justice Ruth Bader Ginsburg. We offered our city's respect as Justice Ginsburg lies in repose at the Supreme Court today. She was a champion of equality. In Boston, we are devoted to upholding her legacy. We fight for the rights she fought for, and we will have more to say about her incredible life in the coming days. I want to transition over to the COVID numbers right now. In Massachusetts, as of yesterday, we had 143 new confirmed cases, bringing our total of confirmed cases in the Commonwealth to 125,866 cases. There were 11 deaths yesterday, bringing total deaths in Massachusetts to 9,118. Boston's numbers are, as of today, 63 new cases, bringing our total to 16,766 total cases. We had no deaths registered today. Our total people who have lost their life here in Boston, 761. I also want to mark that the United States passed the 200,000 number of deaths due to the COVID-19 in the United States of America. Our thoughts and prayers are with all those families who lost a loved one and has lost a loved one all throughout the United States of America and this country during the COVID crisis. For the week ending Saturday, September 19th, the Boston positive rate test rate was 2.7%, roughly level with the previous week. Our cumulative rate since March is now at 7.3%. We have seen a slight increase in hospitalization numbers, so there is an uptick in COVID activity that we're experiencing here in the city. It has not crossed our threshold for real major concern yet, but we are monitoring the situation extremely closely. We're bringing resources to the neighborhoods where it's needed, and we're urging everyone to take this virus as seriously as ever. As far as the state metrics go, we are very close to moving into the red category on the map. That could happen either later today or next week. What that means is that we're seeing roughly 8 new cases per 100,000 people in population. And what it means for us in Boston, that we have to keep monitoring all of our metrics and responding with targeted strategies. We have to bring testing and resources where they're needed and to address the health inequities. We have to keep working with employers. We need to keep working with colleges and universities as their students continue to come back on campus. We need to work with nursing homes. We need to work with all the different institutions in the city. And we need to continue to work with the community. And we asking the community to help us taking precautions that are needed. And we have to continue a very cautious approach to opening. And I'd like to ask Marty Martinez, Chief Health and Human Services, to come up and talk a little more about what this could mean for the city of Boston.
Thank you, Mayor. You know, when we look at the state metrics, sure, I'm Marty Martinez, the Chief of Health and Human Services for the City of Boston. Mayor, when we look at the metrics, obviously on the state level, when we look at the categories of red, yellow, and green, those metrics, as the Mayor mentioned, are really focused on number of cases per 100,000 per day on average. And so as we get close to that, to the Mayor's point, it forces us to really make sure that we're continuing to look at our daily positivity rate, we're continuing to look at our hospitalization emergency room visits, and we're continuing to look at our daily cases as well. And that's an important part, that we look at Boston-specific measures that go into neighborhoods, that look at the inequities based on race, to really make sure we're understanding what's in front of us in terms of that work. And it's a really important piece. For example, we've seen more cases. We've seen a lot more testing happening over the past several months, and so that's been a really important part of this. So as we look at the state metrics and we look at the city metrics, all in place to make sure we're monitoring COVID and trying to work to contain it as we all live with COVID until we have a vaccine. Thanks.
And I'm sure you have many questions about potentially red. So what we'll do, I'll finish the press conference, and then I'll open up for questions. I'll bring Marty back. Any questions you have specifically, okay? That's okay. So as far as our approach, the new state guidelines on restaurants and special events, I want to address that. On seating guidelines, yesterday the governor announced that the maximum per table could go to 10. We are keeping the maximum table in the city of Boston at 6. Other new steps: bar seating, menus, and self-serve drink stations. We will be accepting those recommendations and moving forward on those recommendations. But the one change is our restaurant maximum capacity at a seat will remain at 6 for the foreseeable future. We want to make sure that we do everything we can to keep these numbers down. This is in line with the cautious approach that we've been taking on reopening all along, and it's a response to conditions on the ground here in Boston. Higher density, less space around restaurants, and the COVID data that we're watching very closely. We're going to be continued to be guided by our public health experts on how we move forward. Many other towns and cities in Massachusetts are in a lot different position than we are here in the city, and what we don't want to see is the spike in cases. We're going to continue to support our restaurants as we have from the very beginning. The relief fund and reopening funds. We're also working on streamlining and working with our restaurants on outdoor seating, customer engagement resources like online directories and free signage, technical assistance for delivery services. We want to continue getting your feedback and hearing your needs. We're also going to continue to work with our restaurants as they want to open later into the year, which we've expanded that date already, and working on heating systems so that they can keep outdoor dining going. And any questions that you might have on restaurants, you can go to Boston, visit boston.gov/reopening, or contact our Office of Small Business to learn more. A little more on the COVID numbers, trends in the neighborhood. In the week ending September 19th, most of our neighborhoods are under 3% positive test rate. East Boston rate was at 6%, where it's been for a couple of weeks now. It was at one point 11.4. We've made strong progress, and we're working with our communities to bring down these rates all across the city. Hyde Park and Rosendale are just over 4%. In the last couple of weeks, they've gone a little above, and they're a little over 4%. Dorchester is also hovering around 5%. And we're focusing on, in these particular neighborhoods like we did in East Boston about a month ago, to work to bring these numbers down. This week, our mobile testing team is in Grove Hall in Dorchester. It's at 40 Geneva Avenue, across from the Grove Hall Branch Library. It's going to be there through Saturday, October 3rd. Testing is available to all at no cost, and is available for people without symptoms. For a map of testing or to find out where testing facilities are in your neighborhood, you go to boston.gov/coronavirus. That's boston.gov/coronavirus. If you have an iPhone, you pop in coronavirus testing, and it comes up on the map app right where near your location, wherever you are in the city. I'm going to keep asking people in the city of Boston to continue to take precautions. We need you to be part of the solution. We're not going to set a panic off right now with the increase in numbers, but we are seeing a little bit of trend going up. It is within our control. So I'm asking people to continue the 6 feet distance from other people. That's really, really important. We're asking people to wear a mask when you leave your house. Make sure you have a mask on. If you're walking down the street and you don't have the mask on, no one's around you, holding your hand. If you see somebody coming towards you, we're asking you to put the mask back on. We're asking people to keep washing your hands and cleaning surfaces, washing hands with soap and warm water as often as possible, and cleaning down surfaces. And we're asking you to avoid large gatherings. And one of our rationales behind the restaurant is, quite honestly, we want people to avoid large gatherings. So we're asking you that those are the things that we can do that has been successful in somewhat containing the virus and keeping our numbers relatively low here in the city of Boston. Young adults, especially, this is vital. We need you to share messaging with your peers. We need you to be in contact with your friends. We're asking you not to go to parties, don't gather indoors, and don't be gathering in tight groups. Let others know why you're making the choices to protect yourself and protect your families. I know that you care about your community and you care about helping our city move forward in this recovery, so we're asking you as well in that particular case, particularly if young people, we need you to be our messengers here in the city of Boston. So we're asking if you could do that, that'd be helpful. There is good news that the Boston Public Schools opened this year remotely and very successfully. It was a positive experience by many accounts and people I've spoken to. I want to thank and congratulate everyone involved. I want to thank the teachers and the principals and the parents and the guardians, and of course our courageous, resilient students in Boston Public Schools. I also want to thank the Boston Public School leadership team for their incredible ongoing hard work and continue to work every day. Teachers and school leaders and families are reporting strong advances in remote learning since the spring. So we've come a long way. We've learned a lot since we shut the school district down and then kind of reevaluated and changed the system a bit in May. So I want to thank you. I want to thank all the extensive preparation by our school districts, teachers, and principals. I know that many of our principals and school leaders have been working in their buildings for the last 6 weeks. I want to thank you for your incredible work. I want to thank the custodians. I want to thank the lunch monitors. I want to thank all the folks that had anything to do with helping us getting our schools prepared. I want to thank our teachers and our paras and all the folks. If I missed you, I don't mean to miss you, but I think it's important for us to acknowledge the incredible work that's been going on behind the scenes, quite honestly, with the Boston Public School system. We're continuing to distribute. We distribute over 40,000 Chromebooks to students, and that work continues here in the city. We continue to expand access to the internet for families that don't have the internet, and we're committed to supporting students in whatever they need and the supports that they need. Just to remind everyone on the hybrid phase-in plan that we have, the highest need students will begin in-person learning no sooner than October 1st. Then, starting with kindergarten in each successive age group, we'll begin 2 days there'll be 2 days per week in schools no sooner than October 15th, October 22nd, November 5th, and November 16th. Moving forward, these dates depends on public health data and public health guidance. So if there's a reason for us to push these dates back, we would push these dates back. It's important to note that we're looking at trends over time, not just 1 week's data. So we're looking back to see what the trends have been in the last, quite honestly, 14 weeks in the city of Boston since pretty much the peak of the COVID-19 pandemic. The Boston Public Health Commission and Marty Martinez at his office is monitoring and studying this situation very closely every single day. And if needed, we will adjust the dates of the reopening of the hybrid in-person model. In the meantime, we continue comprehensive safety preparation in our school buildings. Operations and custodial staffs are working hard with supports from the City Hall. In all 125 schools, we're going to be providing dividers and distancing material in all of our schools, tools and strategy for ventilation and airflow in all our schools, sanitation stations and hygiene materials in all our schools, daily cleaning, and also we have the electronic foggers in all of our schools. We have focused on classrooms, on hallways, offices and bathrooms, nurse stations, areas for kids that if they have to go to if they're suspected of being sick, entrances and exits, every inch of space that is thoroughly being prepared for a return of in-person learning here in the city. And we are committed to the protocols that we have developed for our students and staff. That includes an agreement that we reached with our teachers to provide COVID testing and support. And today I'm announcing a partnership to implement that work. The Red Sox and Major League Baseball are going to help us provide COVID-19 testing for Boston Public School teachers. Testing programs will begin at a location near Fenway Park and later move into other neighborhoods. Starting this week, we're expecting 5% of our Boston teacher union members will be randomly tested each week. A random sampling of teachers will be tested from across the city, weighed towards teachers working in neighborhoods with higher positivity rates of COVID. This testing program is an important way to support our teachers and keep our schools safe as we prepare for a hybrid in-person learning. I want to give a special shout out to President Sam Kennedy of the Boston Red Sox and the Red Sox and the Public Health Commission for organizing and implementing this weekly testing plan. In another act of generosity, the Red Sox and Sam Kennedy again and JetBlue, in collaboration with Boston Pride, have donated more than 60,000 reusable masks to Boston Public Schools students and teachers. Students who, when they return for in-person learning, will receive a mask when they return to school this fall. Just a couple quick reminders. One is the 2020 census. Right now, your chance to respond ends on September 30th. We're still urging the federal courts to change the timeline back to what they originally talked about. But we need every Bostonian to assume they only have 7 days left to help us determine our city's future. We've been working with every single community in our city to get the message out in every single language. Recently, we sent out mailers to over 300,000 addresses, and I have a copy of the mailer here, for people to be able to contact the phone number on the back of the mailer, where you can call to make sure that you get counted. It tells you what you need to know, and I'm asking you today to share the message. Since the passing of Justice Ginsburg, we've seen how important representation is. It's our voice in democracy. It's how we fight for our rights. So it's really important for all of us that we make sure we fill out the census again in the next 7 days. With that, I'm going to open up to questions. I have one question submitted from GBH. When will the police task force recommendations be available to the public? The task force had their final session, public session yesterday. Over 125 Bostonians attended this session and provided thorough feedback. That's a great response to our process. I want to thank every single person who took the time to give their input yesterday. The task force is preparing final recommendations, and I look forward to receiving them. I want to thank former U.S. Attorney Wayne Budd and all the members of the task force for their incredible work. I am committed to taking action that responds to the community's concerns and strengthens our national leadership in police community relations. We believe in lifting people up, not locking people up. And I think that that's the questions on this I have for you. So I'm going to open up for you, and you can ask me a question or to Marty. The question is the city preparing for any possible protests there or the next few days? You know, I definitely think there'll be some demonstrations, and you know, I think people are still trying to understand what the Attorney General in Kentucky did, and what they, quite honestly, I can't understand what the Attorney General in Kentucky said, and that's why when I talked in the very beginning about greater transparency, there needs to be greater transparency in the process. You know, I think that the president of the NAACP, Boston, Chief Sullivan, tweeted out earlier there's a need for national police reform. And I think here in Boston, I just mentioned about the task force. You know, we acted quickly here in Boston. We're going to continue, and we're going to act quickly when the recommendations come in, and continue to build that trust. But I think that, you know, as far as the question, I think that there are some demonstrations planned for today.
Mayor, what's your message to people who like after this evening?
I think it's important that I don't need to give people a message. I think that after I think it was the first protest here in Boston, when downtown, where we had some, you know, destruction of property, things like that, that didn't happen again. People marched around the city. People went around and let their voices be heard. And I think it's really important for people to have their voices heard. And I think it's really important for people to hear what people are saying. And I think that that's the beauty about free speech, and that's the beauty about being able to, I wish we didn't have to have this today. I wish this press conference was about something else. Quite honestly, you know, it's in February, when COVID-19 came here, from when we first got a case in Boston, you know, Breonna Taylor and George Floyd were alive. In that time, there's been a lot of conversation and concern in this country and dialogue about systemic racism. I stood at this podium a few months ago now and talked about what we can do in Boston. I wish I could do something greater on a global scale or a nationwide scale, but we can't. What we can do is have our voices heard, and I think that that's really important.
Mayor, the sun is kind of...
I'll come back. Oh, son, yeah.
Translator, go to the other side.
Oh, you can do that. Sorry, I thought it was me. I can't see you. I thought you had a question for me.
No questions.
Yeah, sure.
You talk about there's uptick in coronavirus activity. Are there new steps or new steps that the city should take?
Yeah, I'm going to have Marty, I can probably address that too, but I'll address some of it as well after. If you get the question?
So the question was, with some of the uptick we're seeing, are there new things the city should take on? And I think it's doubling down on some of the efforts that we put in place. And part of that is looking at the data to understand where are we seeing neighborhoods that need increased supports and resources, which is why we, as the mayor mentioned, we are taking the mobile testing to Grove Hall starting yesterday for 2 weeks. It's also why we're doubling down on our prevention messaging in neighborhoods, why the Public Health Commission's working in collaboration to strengthen strengthen outreach around getting tested, but also the measures that we put in place to make sure people know social distancing, not in groups, and really trying to make sure we're being as conservative as we can be. So I think we're trying to double down on those efforts.
Does double down mean putting more resources into it, or?
Yeah, the question is double down meaning more resources. It always means more resources. I mean, we've been putting more resources. Right now we're having conversations with health centers about providing more funding to them so they can increase testing access in the neighborhoods. We've also been working with trying to do a multilingual campaign, which actually will start tomorrow in East Boston, related to some of the outreach that's necessary so people know some of the messaging that's important. So the city is looking at data every single day and responding to it so that we can contain COVID as successfully as Bostonians have helped us to be able to do. Sure. Yeah, I mean, the question is how much uptick can be contributed to colleges and universities. There's no question that colleges have done what we've asked them to do, which is test. So it's really, really important that they're testing students and that they're testing on a regular basis, and they are finding cases, right? So there is a piece of the uptick that we're seeing that is college students, but to be frank, I'm glad they're testing college students. We want them to test. That's how we contain. That's how we trace. So that's an important part of it. To the mayor's point, that's why Boston's more unique than some of the other cities and towns across the state. We have many college students here, so that testing is an important part for us to contain the virus, but that is a part of it. Yeah, so the question about transmission to the larger community, we always are concerned when there's cases, but that's why the tracing is so important. So we work in collaboration with the universities, with the state, to make sure we're tracing for contacts, and the universities are working hard to do that. There's no question we want them to keep working, containing off-campus things, containing things that are, parties and other things that we don't want folks to have, but it's really, really important that we have that testing happening so we can trace people's contacts. Thanks. Yep. Yeah, so the question is, if we move to the red zone, what kind of implications does it have? I mean, again, the red zone, which is the state category, is really counting number of cases only per 100,000 people. It's an important measure, but for the city, we look at a broader set of measures. So we're looking at positive percentage rate, which you have to match cases versus how many people are getting tested, as well as looking at our hospitals. If you have a lot of severe cases, you want to see, can our emergency room handle it? Can our ICU handle it? So if we go into the red zone, which we're close to have happen, we're going to continue to do that and double down on the efforts that we already talked about, and make sure we're monitoring our own data so that we can see that. Just to give you a sense, we've been climbing in our number of cases per 100,000, even though our positive rate is still pretty low, relatively low at 2.7%. So again, we want to test more people, which means we're going to see more cases, which is an important part of containing COVID.
What is driving this uptick? Like, is it neighborhood gatherings? Is it restaurants?
Yeah. I mean, it's a combination of everything. I mean, the question is what's driving the uptick. It's a combination of things. I mean, when the weather's nice, more people gather, more people go out to eat, more people do things that put them in different settings. We also have a lot more college students back. I mean, there's a combination of factors. We're not seeing just one thing. We, of course, have seen gatherings in places we don't want to see. We've seen, people come together in parks and things that we're trying to prevent. But again, Bostonians, from my perspective, they've done, a huge amount of work to make sure we keep COVID low in the community, and I'm so appreciative of that, as is the mayor. But we just got to keep up that due diligence and make sure that we stay on top of all the messaging that we need and the precautions that are necessary. Thanks.
Yeah, tomorrow, right? We'll know possibly tomorrow?
Yeah, we would know by the end.
We'll know by the end of, probably by then, sometime today through tomorrow. And if it's not this week, it potentially could be next week, so we're just letting people know. Just to go back to Sean's question, the red zone, for me, does not make us think that we have to shut down the city of Boston. We're not at that point. We're looking at the average daily testing rate in the 7-day period. If we got into a lot higher than a 2.8% infection rate, I'm talking like in probably 9-10 would be concerned. We're taking the precautions on the restaurants today is because we are seeing that small uptick. And what we want to do is make sure that customers of restaurants are safe, making sure that staff at restaurants are safe, and making sure that we're not adding to increasing that number of potentially infected COVID patients. So we want to do that. And we're also monitoring, if you remember back in in the midst of COVID, our emergency room capacity wasn't there. I mean, our emergency rooms were packed. That's another monitoring point that we're looking at to see. That's really the indicators for us is where we are in this. So we're not looking at shutting everything down. That's not where we are today. But we are saying to people we need to be a little more careful. Really, probably the first time that we putting a little red flag up, ironically, in the last 14 weeks. And again, in some cases, within all our control. That's why today I talked about young people, if you could use your networks to get information out there to people, asking people to continue to wear the mask, monitor where you're walking, washing hands, cleaning down surfaces, all of that stuff. You can see there's a little more activity happening in the city. So there's more people out and about. I've noticed more people walking around. Even today, there's more people here than in the last couple of days. So that's great to see, but we need to wear masks. You need to keep social distancing. You need to wash your hands. You need to take care of yourself. So we want people to be careful. I can't answer the question, all the questions you've asked, because it's the first time I brought up. I know that we're doing everything we can to make sure that we get internet access to our poorer families, and that includes families in shelter, kids in shelter. I'll get back to you on that answer. I don't have it. The question was, and we're only with 2 days into school, so I don't know where that came from. So, but I will look into it. The question was the concern of families that are living in shelter, families that are homeless, that don't have access to proper internet, don't have access to proper equipment, and families that, mothers and fathers that have to go to work and bring their children with them, where they don't have adequate child care, don't have child care, or schools to send them to. I'll get that question. I don't have a full answer on that. We'll be talking about all that. I think I'm going to be announcing all those tomorrow. We're trying to finalize. Logistically where we're going to be doing early voting, drop box, all that stuff. I think it's tomorrow. We tried to do it for today, but we couldn't get it done.
You did mention yourself. It's been weeks and weeks about the good news in the city, and this is sort of the first time in a while that you've said, listen, we're sort of facing a little bit more of an issue.
Yeah, I want to just make sure that we'll raise awareness of the situation we're in with COVID. I think it's really important. It's not time to panic, but it's certainly time for us to. We don't want to go back to a situation where we're shutting everything down. That's not where we want to go. I've seen too many cities around the world, in cities, quite honestly, in the United States and states, that have shut down, opened up, and now they're all shut down again, and the numbers went through the roof. That's not what we want to do here in Boston. We don't want to go into that situation. I think that, for the most part, that won't happen here. But again, the virus is unpredictable, and we're taking this a day at a time.